Hi, my name is Asia Simmons, and my field of interest is pediatric medicine. My internship was at MedExpress in Dover, Delaware. At MedExpress, I was a floating observer, meaning I was able to observe within different parts of the facility, shadowing a physician while learning hospital protocol when it comes to patient treatment. And that really opened my eyes to learn how a hospital expects, a urgent care facility expects you to care for certain patients and how to address them when they come in. MedExpress is an urgent care center that provides immediate walk-in treatment for illnesses and injuries. The mission at MedExpress is to help people live healthier lives and to help the healthcare system work better for everyone. I'm advocating for hospitals to expand and educate in order to provide quality care for all patients, no matter the injury. At MedExpress, there are physicians, physician assistants, nurse practitioners, and registered nurses that I was able to see in action. These medical professionals provide quality care to walk-in patients such as treatments for illnesses and injuries, wellness exams, and even employer health services. The mission at MedExpress is to help the healthcare system work better for everyone, and they do this by helping to manage chronic conditions and by reducing unnecessary ER visits. For some patients, an emergency room functions as a primary care office. This is because many patients are not correctly insured as well as educated about the services MedExpress provides. MedExpress provides services for everyday illnesses and injuries that require timely attention and at a smaller cost in a timely manner. The average wait time in emergency rooms can go up to 4 hours compared to the 1 hour at MedExpress not many are aware of. And the average cost of care in the emergency room is $1,423 compared to $155 at MedExpress. With affordable costs and timely care, MedExpress can provide care for patients in a short amount of time as well as open their doors to patients who are worried about the cost of care. This will allow the correct patients to avoid the ER, thus limiting overcrowding in the ER. A lack of adequate staffing in hospitals, starting in emergency care departments, can cause a rise in mortality and morbidity rates. I suggest a partnership with MedExpress and hospital emergency rooms all over the U.S. to help effectively separate those patients who come in without major health problems versus those who do suffer from such, which causes an increased wait time in emergency departments. We can accomplish this by making sure each MedExpress and emergency room kiosk working together has an efficient amount of staff. We can then work to increase advertisement to allow patients to know the correct facility to go to for care. This will also add to the education of different patients who come in. Next, we can then work to allow workers to divide the patients based off of their needs in order to implement this partnership. We will use the 17 states that have the 200 plus MedExpresses that are located within 17 states. Each hospital within those states will have up to 2 MedExpress centers in connection to them. Each hospital manager will be in control of the information given to patients to navigate the correct patients into the correct standard of care. This can be done by orchestrating patient check-ins, which will be completed before each checkup by each patient to track the number of patients checking in. We will also use data sheets. This will be for the physicians and care providers to evaluate their patient's level of care needed. And lastly, but the most important thing, will be patient surveys, which will be given to patients to collect an evaluation of the patient's satisfaction of care provided. The patient surveys will help us to measure the success of this partnership. The main goal is for patients to receive quality care within the correct facility. This will work to diminish the chances of mortality and morbidity rates rising in hospitals due to the lack of staffing and resources. In order to implement all of this, we will also need a budget. Within this budget, we will divide it between personnel costs and operating costs. Within the personnel costs, we will have a smooth budget of $67,668. I apologize. I said that so wrong. $67,688 will be our sub personnel cost budget. This will consist of front desk associates. We will need them in order to operate the hospitals and the MedExpress front desk and kiosk. They will get 25% of a full-time salary and benefits to coordinate outreach, data collection, and overall hospital organization. They will come up to $14,963. We will also need paid volunteers. We will need up to 40 of them. There will be part-time staff, which will include wage and fringe at about $9.50 per hour, 5 hours a week. And they will come up to $52,725, which comes up to the whole $67,688 for the personnel costs. We will then have the operating costs, which would consist of everything we need in the hospital and medical care. Sanitation and beds, which would be for each worker to sanitize their hands while providing care, sanitizing the rooms, and for patients' comfort. This will come up to $125,000. Next, we will need lab supplies and technology to provide tests and evaluations for patients who need it. This will come up to $500,000. Next, we will have the certified caregivers, which will come up to our doctors, our nurses, our nurse practitioners, and that will be just the people who provide the care to the patients. That will come up to a budget of $1 million alone. So subtotal for operations will be $1,625,000. Thank you.